Choking happens quickly, and more often in infants and children than in adults. So it's important to be prepared in case you need to help an infant in distress. Choking occurs when something gets stuck in someone's airway and makes it hard for them to breathe. An infant experiencing mild choking can still breathe, make sounds, cry, and cough. You may not need to intervene in these cases. An infant experiencing severe choking can no longer breathe, make sounds, cry, or cough. This is an emergency.
It's not always easy to tell if an infant is choking.
If the infant's face becomes discolored, if they're struggling to breathe or make sounds, or if they're tearing up or severely drooling, they are severely choking. If someone else is nearby, have them call 911 and get an AED while you help the infant. Get into position to provide help right away. To help an infant who is choking, you'll need to alternate between giving 5 back blows and giving 5 chest thrusts. For back blows, place the infant face down on your forearm. Support the infant's head and jaw with your hand. Rest your forearm on your lap or thigh to support the infant. Make sure their head is lower than the rest of their body. Then, use the heel of your free hand to give 5 firm back blows between the shoulder blades. This will push air from the lungs, helping to force out the object that's blocking the airway. If the 5 back blows do not clear the airway, move on to chest thrusts. Never give abdominal thrusts to an infant because they can cause serious harm. Give chest thrusts instead of abdominal thrusts. To give chest thrusts, you'll need to turn the infant over. To do this, place your free hand on the infant's back, supporting the back of the infant's head with the palm of your hand. The infant will be cradled between your forearms with the palm of one hand supporting the face and jaw, while the palm of the other hand supports the back of the infant's head. Turn the infant over while carefully supporting their head and neck. Hold the infant face up with your forearm resting on your thigh. Keep the infant's head lower than their chest. Place the heel of your other hand on the lower half of the infant's breastbone, just below the nipple line. Push downward on the middle of the chest 5 times at a rate of about 1 thrust per second, creating enough force to dislodge the object blocking the airway. Alternate between giving 5 back blows and 5 chest thrusts until the object is forced out and the infant can breathe or cough, or until the infant becomes unresponsive. If the infant becomes unresponsive, place them face up on a firm, flat surface and start CPR immediately. Use the AED as soon as it's available. Have someone call 911 if they haven't already done so. After giving 30 chest compressions, look in the infant's mouth to check if the object has come out. If you see an object, take it out. If you can't see the object, do not reach into their mouth to try to find it. You can accidentally push the object in farther and make things worse. If the object did not come out, give 2 breaths. Continue cycles of giving 30 compressions, checking for the object, and giving 2 breaths until the emergency responders arrive or the infant starts responding and breathing normally. If you're alone with an infant who becomes unresponsive after choking and you do not have a phone, it's important to complete 5 cycles of CPR, starting with giving 30 compressions, checking for the object, and then giving 2 breaths before you leave to call 911 and get an AED.
No matter what, any infant who receives choking relief should be seen by a healthcare professional.
Now, you're ready to help an infant who is choking.